Welcome to Imperfect Heart, a place for you to join me, Jeff Holden, in conversations, discussions, and dialogue about our hearts and the impact myocardial bridges have on them. We'll talk with healthcare professionals, those in related fields that support our condition, and others just like us with stories of their myocardial bridge experiences. It's my intention for this content to inform, educate, entertain, and even motivate or inspire you in your personal journey on dealing with a myocardial bridge. Most importantly is to have you leave each episode with hope, knowing you're not alone and that what you're experiencing is real. I want to tee this episode up with a different type of introduction. The person I'm going to be speaking with is much more than a guest, much more than one of our Myocardial Bridge Facebook friends. It happens to be one of my best friends. And I know you're probably thinking, why is Jeff bringing on one of his best friends? Well, it's probably because he wants to talk about how it's important to reach out and not try to deal with this journey alone. And you would be partially correct. Only you're probably thinking about how this gentleman, my friend, supported me during my journey. And that's not the case. Not that he didn't support me, but that's not what we're going to talk about. We know that roughly 1 in 4 people have this condition, right? 25% of the population is estimated to have a myocardial bridge, maybe more. Think about that stat for just a minute. How many friends do you have? You see where I'm going? Mark Davis is joining me on this episode. He's been on this journey now for nearly 3 years, and a lot of it's going to be familiar to many of you. As an executive with our local airport, he's required to travel a lot, all over the world. And wherever he travels, it's expected that he is going to be able to do all the things that are expected of a guest to the respective countries he visits. He's representing us. You'll hear about what that looks like today and how it's changed from what it used to be like for him. And not unlike many of us who have been there and many of you who are there now, he's on the last leg of this journey, about to be needing to make some decisions. To me, it's incomprehensible that one of the very same people I was sharing my story with 3 years ago, somebody who was supportive, concerned, and involved in my well-being, is now on the exact same receiving end of my concern. This not only could happen to anyone listening, but likely will. You're going to find his story compelling as we discuss where he's been, where he's at, and what his next steps are. And yes, he's been recently diagnosed with a myocardial bridge. Mark Davis, welcome to Imperfect Heart.
Thanks, Jeff. It's kind of strange being here with you since we know each other for a long time, by the way.
I totally agree. This is one of the more unique episodes I'll ever do, and I would be remiss if I didn't say that it isn't a bit emotional for me to even be having the conversation with you. As our listeners already know from the introduction, you are a dear, dear friend. And there's 2 things I want to reiterate as we begin the conversation, and that is that this disease affects 1 in 4 humans on average. 1 in 4, 25%. Meaning it's really likely that every single one of us knows somebody with a myocardial bridge. And the second part of that is the condition is gender, race, and ethnicity agnostic. It doesn't care who you are, where you're from, or what you look like. I mean, whoever would have thought that somebody in my inner circle of close friends, you of all people, somebody who supported me on my journey, both pre and post surgery, would end up with the very same condition at about the same age with a similar diagnosis.
Yep.
And the difference between our symptoms is really the distinction of the two. And by the way, our race, for those of you not listening, not watching, for those of you listening and not watching, Mark is African American. So I'm truly blown away by the fact that you and I are even having this conversation, because it's really hard for me to believe, as you said, that we are. What are the odds?
Exactly. Yep.
Let's go back a couple of years to where you first began recognizing something was wrong and you were actually sharing it with me. Tell me,
Yeah.
it's almost 3 years ago now, right?
It's been about 3 years. Yes, exactly.
Tell me a little bit about what was going on.
Well, I remember vividly when you informed me and some of our other friends about what you were going through. It was it was sort of strange that me knowing you how you are, such an athlete, and all the things you've done to see that you were going through this and all the symptoms. Um, but then as we were talking and when I started developing my symptoms, you're the ones who came out and said, I think we might have the same thing. And, but it was really strange knowing you, and you were training at the time, I believe, for the Tahoe death ride.
Right.
Right. And you started having all these little mini heart attacks, and it was really, really strange. And it was I was very concerned. So yeah.
Yeah, and I remember it took us a while to get to the point where I even thought you might have something like me because you were describing your symptoms. What were they initially when you first started recognizing something was wrong?
So I remember it was right when we were going COVID first started. And, just to get out of the house and be amongst people, there was a few people I worked with who said, let's go out for runs." And so, I was a runner. I mean, I wasn't a marathon type guy, but I could run a 10K, and I was at one time training for a half a marathon. So we started running, and I remember, uh like the first quarter of a mile, I was having these pains. At first, I thought it was like these pains you get in your side when you first start running. Then I realized, no, it was across my chest, and it was like, I can't even run a mile. This is crazy. But I tried and kept trying, running. Then eventually, I just couldn't do it.
Mhm.
And so that was basically my symptoms. This massive pain across my chest that it would not go away when I was moving forward.
And it continued to deteriorate, right? Because I recall I keep checking up on you and saying, "What are you
Yeah.
doing? Are you going to the doctor? Are you
For
doing
sure.
what you're supposed to
Well,
be doing?"
yeah, initially it started it wasn't as bad. I mean, I would run and I would get through a couple miles, but still not easily. Now, as you say, progressively has gotten worse, and I can't run at all. I do walk. I try to walk. Like, for example, on Sunday, I went for a walk, a 3-mile walk. The first mile, it was very, very painful. Then eventually it goes away. I don't understand that, but that's what happens.
Mhm. When you started the process of investigating with doctors, obviously went to your primary care, you've gone through a litany of things, and this is not gonna sound unfamiliar to any of our audience. They're gonna go, "Oh, yes, yes, yes."
Yeah.
Tell me kinda like where you started and what you've been through to date, and if you forget some of the sequence, I remember some of it, so
Yeah. So
I'll pop in.
so because it's been, 3 years, some of the things I forget, but I remember going to my primary care physician. I love this guy. He listens. He takes your advice, and so if I say, "It's what's going on, can I go get this?" He's very open to that. So we had conversation. He said, "Well, it might be a lung problem." So I went to a pulmonary specialist and did tests there. Couldn't find anything. Then I went to a cardiologist, and we had the chest X-rays, did X-rays and CT scans with and without contrast. So the cardiologist says, "Okay, we can do an angiogram." So, okay, he said, "You know, but there's risks." So we did the angiogram, come back, my arteries are clear. He says, "My heart is healthy. I don't want to see you again." Then I asked him, "Well, what about a myocardial bridge?" He says, "I don't even want to discuss that." And that was it. And go back to the doctor. He says, "Okay, well, maybe it's a gastro problem." So I went to a gastroenterologist and did tests there. And, I had a little reflex problems, but nothing that would cause the chest pain that I was experiencing when I actually ran or walked moving forward. And so, that's where when I went back and had some other tests done, I was this uh, this CAT scan that elevated your heart while you were I forget what it's called, but
Like
that's when
The Lexicon.
yes, actually, that's exactly what. And, couldn't find anything there either. So I went to a new cardiologist, she had never heard of the myocardial bridge. But she said, "I'll refer you to one of the, he's considered one of the, uh, very respected doctors in town." So I finally got in to see him, had a nice discussion. So he said, "Okay, we'll do an angiogram."
Again,
Angiogram kind of provocative, but not with all the tests. So did the angiogram. There he found few things, but nothing that he could describe as a myocardial bridge. And and that happened about 3 months ago, and that's where we are right now.
well, you
After
did,
all these tests, they still can't find it.
yeah, you did have that CT with contrast that has now clarified the fact that you do have a bridge,
Yes.
right?
Yeah,
That was
yes,
most
exactly. So
recent.
the radiologist came back and said that there was some reduced, blood flow
Mhm.
in the artery there, which he kinda described as a myocardial bridge. But the problem is getting cardiologists to quite understand exactly what that all means.
Yeah, and to fess up on it too, to say, "Yeah, that really is." I'm gonna share with our listeners for a second because you sent me that first CT scan, with
Right,
contrast description, and I didn't understand it. I said, "I don't this doesn't make any sense to me."
right,
The key line that I'm gonna explain here, "The left anterior descending, some mild calcified plaque in the proximal LAD without evidence of stenosis," which is very typical, where that's where the artery is entering into the heart. 100% of the time, there's either a bit of plaque buildup or some narrowing. Then it goes on to say, "The LAD does not have any bridged segment. However, the main diagonal branch does penetrate the myometrium compatible with a bridged segment of the first diagonal branch." And I'm thinking, okay, well, that means the LAD has a branch, which is still significant, that
right,
is bridged. But I don't understand. What's this myometrium? I've never heard of it.
right,
I think so I look it up, and Mark, my dear male friend, you have a uterus.
right, exactly.
The myometrium is the tissue of the uterus. And I'm like, dude, something's really, really wrong here.
Yeah.
You gotta go back there and figure out what are they saying?
So that's right. I remember that now. So I went back, I sent an email to the, radiologist and to the hospital and said, "This is completely wrong." And very shortly afterwards, the radiologist went back in and updated his findings, uh, and they made an excuse, well, he was extremely busy, but he came back and said, then he came back and said, "Yeah, there is a serious, issue here." And
Mhm.
did I share that with you, that the second one? Yes.
Yes. Yeah, and that's the good news because the first one was about a page and a half of just a lot of blah, blah, and maybe
Right.
3 lines about the possibility and a little bridged segment. The second one comes back and it's 4 pages. It's really in depth, and
Yes, there
the
is.
line on the second one that I'll read is, "The LAD at the level of the cardiac apex, just proximal to the wraparound segment," which is another issue that you've got, "has significant reduction in flow, and on the angiogram images has a narrowed segment, which is just beyond the last diagonal branch, which is where they said that there is the myocardial bridging."
Yes.
So, the good, bad news was when I read that, it was like, "Oh my gosh, you have what we have."
Yes. Yes, I remember you telling me that. You said, yes,
And
there is a significant chance that you have what you have."
right,
Yeah,
and I was relieved to say, "Hey, I think we found your issue." But I was, quite saddened really to say, "Oh my gosh, you have the same thing." And again, the odds of that would seem so strange, but again, 1 in 4 of us,
yeah,
25%,
yeah.
you got 4 friends, one of you has a bridge in some way,
Bridge,
shape,
right.
or form. So now that you've been diagnosed, you're into what many of us recognize as the next step of the journey. The great news is you know what the issue is.
Yes.
And now it's to the next steps. What most recently now, where are you? What's happening?
So, I went back after I actually had the second angiogram, I go back to the referring cardiologist, and she said, well, because she had told me that if I was not happy with the results, she would refer me to Stanford, which I asked.
Mhm.
And so she came back and said, okay, I will refer you to Stanford. Um, so about a week later, I get a call from her office indicating that uh, the referral was denied. They want me to go back to my to the doctor who did the second angiogram because I would not go back to the first doctor who said
Right.
I don't want to talk about that. So I have not made the appointment yet, but I plan on hopefully trying to get to see him next week to let him know what the issues have been and if he could refer me because as you know, here in Sacramento, the hospitals are not set up to do all the testing for a myocardial bridge. And
Right.
so I want to see where this progresses.
Well,
You know, and like a lot of your listeners, people who I know you've talked to and all, they have issues trying to get into these hospitals, and they're very expensive. So if I can't get through Stanford, then I'm going to try to make arrangements to pay for it myself.
and we've got a couple of situations. You're from Ohio, which is not too far from Pennsylvania.
Right,
If need be, you could go back and go to UPMC and maybe somebody like Dr. Fowler could see you,
exactly.
from his provocative test process. Uh,
Hmm.
obviously Stanford's the closest. We're in Northern California, so that makes sense. And
Yeah,
go ahead.
yeah. I was going to say my doctor, the cardiologist who did the second angiogram, he he actually watched part of that segment with Dr. Fowler, and he did tell me that that's where he did his training at University of Pittsburgh Medical Center. Yeah.
Well, the good news there, Mark, is that there's some credibility then he can relate and say,
Yes.
"Okay, well, that's probably a pretty good doc. It's pretty good program." And the reality is that what he's doing is beneficial, and we need to get you into that space.
Exactly. Yeah. So that's where I stand right now. It's you know, I know a lot of the people who listen to you and have commented, it gets a little frustrating because, you know, you think you're somewhat of an athlete, but you can't do the things that we know age does catch up with you, but still there's some things that I should be able to do without experiencing this chest pain.
Well, and to your point, you travel a lot, and part of that travel changes the dynamic of, atmosphere and elevation, and there's a lot of walking in many cases for what you do. That is stressful.
Yes. Yeah, that it brings me up to another point. I just returned. I was 2 weeks ago, I was over in Europe. I was in the Czech Republic for a conference, and from the hotel to the conference center, which was in an old castle that was and most castles are at the top of a hill. I had to walk. It was I guess it was about a football field and a half if you know, from the bottom to the top, and
Mhm.
I had to stop, halfway through just to catch my breath and have the pain sort of, alleviate somewhat, before I could continue on, which is
Sure.
again, it's just mind-boggling to at this point in life to figure I have to stop walking. Yeah.
Especially when you are in good shape, have been in good shape, you recognize your conditioning, and here you are in good shape,
Yes.
unable to do, a flight of stairs in some cases. I even remember you telling me you
Yeah.
were walking through the airport once and had to stop just because the pain got so severe.
Yes, exactly, yeah. Yes, unfortunately, sometimes I have to avoid walking upstairs. I still walk downstairs, but like in the airport environment, I will take an elevator up, but I will walk down. Yes.
And the good news for you is, and it could be because of the way the bridge is and your particular makeup of the heart and the arteries, you're not in a debilitated state yet, and
No.
your deterioration hasn't been incredibly rapid like it has been for some of us. So you've got this benefit of time as you're working through the solution to find what really is gonna be the best result for you, and that's a plus. So
Yeah.
That's one thing. On the other side of it, what is it you worry about at this point?
Well, there's a couple things I worry about, and I think a lot of people would have probably the same concerns. Number one is, will I be able to find someone who understands exactly what's going on, and can this be resolved? Uh, that's one. But the other thing is also, I actually live alone, so sometimes I'm worried that, well, what if I just drop, and how long will it take someone to find me? So that's a concern, which I don't think no one wants to really be worried about that. But yeah, that is. Um, uh, I think the most important thing is, will the medical establishment recognize this myocardial bridge, and will they start, acting upon good science that's already out there? And it was kind of hard to understand why some cardiologists know about this and understand it, and why others either they don't want to know about it or they just haven't found it out about it yet.
Right? And I I think we all agree with you on that one. It's what is going on
Yeah.
when there's so much evidence to support our cases.
Yes.
And
Yeah,
to
when
your
you have
point.
reputable, institutions like Stanford and, University of Pittsburgh Medical Center and, and Cleveland Clinic and all these other places that know about it and recognize it, why don't other doctors, uh, believe it?
Mhm.
Yeah.
And I wanna reiterate the point that you made about people who are alone.
Yes.
That's a big deal. If
Mhm.
if you have the condition, to be certain that you have some contacts that are aware that if you go dark for a day or some
Yes.
reasonable amount of time depending on your age, to check in, even if it's just a phone call or a text, or if you have a 911 button on your phone to some friends that you can just hit,
You're right.
the the likelihood of it being catastrophic is slim, at least to the best of our understanding.
Okay.
But it would be my contention that there are people who only have the symptom occur once, never knew it was a severe blockage, and that blockage was right at the point where the artery went into the heart,
Right.
and maybe they had some mild symptoms but didn't really know, and the next thing you know, that blockage breaks free, they have a massive clotting situation, and it's over.
Right. Yes.
Mm. That's the unfortunate part. The good news is you're aware.
Yeah. Yeah, I remember you telling me that you were it was such a debilitating situation for you. You could hardly walk from one side of the room to the other. That is that was mind blowing, because especially me knowing what type of athlete you have always been, it's kind of was really scary.
I'll take that as a compliment.
Yes, exactly.
I certainly don't think of myself that way, but, yeah, I agree with you to think that so quickly something like that could happen,
Right,
and everybody's journey is different, and that's the significance of your journey because people are out there who think, "Oh, well, it's fine. It's not that bad.
mm,
It's getting a little bit worse, and every year it gets a little bit worse," but there's a
right,
point when the 2 things come to a cross in the roads where you're at a certain age where it gets really difficult to have the surgery because you're so much older,
right.
and then you are debilitated because the situation never cures. It has to be addressed medically, either through medication and or a surgical process. Something has to happen or it will continue to deteriorate.
Yeah, I think, there might be some people out there who can live with this and accept things as they are. It's part of getting old. But I mean, the quality of your quality of life really changes if that's what you accept. And I don't really want to accept that. I mean, I think there's a lot of good years still ahead that I can do certain things. And I like you said, I love traveling, and for my job I have to travel. So if you have these issues, then that kind of eliminates the whole aspect of traveling, because you're just not able to do some of the things you would need to do when you're traveling.
Well, and you're my tour guide, so I need you around
Cool.
for a long
Yeah.
time. So whenever I
Yes.
want to go, you
Yeah.
can tell me, you can tell our audience,
Yeah.
you certainly are the first person who is involved in travel
Yeah.
that I've spoken with. So you might get some direct messaging through Facebook about gee, Mark, if I'm looking at this as a celebration, or maybe I'm going to Greece for my surgery, or maybe I'm going to Pakistan for my
Yeah,
surgery,
right. Yeah.
is there something I can wrap into that as we get things taken care
Oh,
of?
yeah, exactly, right.
So, what would you say to others who are in a similar situation as yourself? Because you are now part of our collective. You will find that this is an incredibly supportive group and everybody's there for everybody else. What would you say for those people who are just orienting today? You're 3 years into your journey, and you've been identified, so now your process is just getting, a solution and understanding the severity of your condition. How about somebody who's maybe just in the middle or just starting?
Okay. Well, the our medical system here can be very onerous and very complicated, and a lot of people accept what they're told initially and go from there. I would say never give up. Keep pressing ahead. If you can't get what you're looking for from one physician, find someone else who will listen to you and at least help you go through this journey. And again, with with the Facebook group, I mean that's probably a godsend to a lot of people. The
Mhm,
fact that they have someone that understands what they're going through. And, a lot of times we go through things and you feel alone, but with this, you don't have to be alone. So I would say, with you starting, I mean, what you have done with this group is just amazing. So, uh, and I think I've always complimented you on what you have done with this to help people feel that there's a way out. So
mhm.
and so I want to thank you again here on online like this for what you have done.
Well, if I ever thought that you would be a fan of the of the podcast, because typically it appeals to people who are symptomatic,
Right.
and, here you are symptomatic.
Systematic, right.
Would have been the last thing I ever would have thought of.
Exactly. I would, yes. For all things, right. Yes.
You are so close, Mark, to a resolution. I wish I could move it forward for you. You're
Mm,
just at that point, and I'm anxious for you to get that provocative test because I wanna hear what comes back, what the
right.
severity of the blood flow restriction is. You have some other complicating, conditions with the wraparound artery and some of the other arteries that seem to have a little bit of bridging going on, so it's gonna be really interesting to see what comes back, but I think when you do get it, it's gonna reveal so much, and whomever that doctor is that ends up doing the testing for you is gonna be able to give you a really clear outcome and read on what the next steps should be based on that blood flow restriction and the severity of what's happening because you are symptomatic. So that's a big plus, and it's only a matter of time. You'll get there to your point of being, really persistent, and unfortunately, we do have to have some patience as we go through it, just not
Yes.
worth it. How are you staying positive?
Well, uh, I just get myself involved in other things. I'm involved in a lot of community activities, have really good friends, family, and, it's just, I've always had to be kind of positive in my life. I mean, uh, I've really never been a sort of a downer type guy. So, uh, there you can find positive things in a lot of things. So, um, you just have to. I mean, it's like solving a puzzle almost, you gotta take some sort of joy in that, yeah. So that's what I kinda do. I mean, I have no other choice, you know? Yes. But
Yeah,
and
no,
one thing I forgot to mention about the doctor who did my second angiogram, because I think I've heard you mention before about, the treatment possibilities, either surgery or they sometimes maybe try to treat it, uh,
medically.
through medically, So my doctor has put me on a beta blocker, but I
Ah,
had it has n I have no change whatsoever. The only thing I've noticed is that my heart rate has dropped quite a bit.
yeah, that's something you gotta watch too. You don't want
Sure
it to
it
get
does.
so low because then your blood pressure will come down with it, and the next thing you
Right.
know, you're tripping and falling and
Falling
real
right,
consequences.
exactly, yeah. So, but anyway, I'm a positive guy, plus I get to know people like you.
Well, brother, I get to know people like you, and
Yeah,
it's certainly my privilege. You know, I'm here to support you however I can, whenever I can. And anything you need, I'm here for you. Let's get you to Stanford. Let's get you to Pittsburgh. Let's just get this thing identified, and we will share the results through the program
Okay.
as well, so people know, hey, what's going on with that Mark guy? I mean, we were really
Yeah.
curious because his situation was just like mine.
Yeah. You've been extremely positive through all this too, man. Some especially what you went through, but you have a great family, great wife, great kids. So uh and I know them and that really, really helps when you have something like that on your side.
No, I couldn't agree with you more. It makes all the difference in the world,
Yes.
and we need people around us.
Yes.
Nobody's gonna get through this alone.
Yes. Yeah.
I can't reiterate that enough. You cannot get through
Yeah.
this alone.
Yeah,
You have
I have family members who contact me all the time about asking how I'm doing, and I have a really, really close friend that I grew up with. We've been friends for 55, 60 years. So,
that
no,
means you're really old,
55 years,
really
right?
old.
Yeah, and so yeah, he contacts me all the time, make sure I'm doing well. So yeah,
Good. Well, Mark, I can't thank you enough. I truly, truly appreciate it, and while I am saddened that it's somebody I know so well that
right,
has the condition that who knew, right?
right.
What I'm really happy about is that it's something I can help you through, and
Or
I've been there.
I hate seeing you go through that, but I tell you, without you going through this, there is no way in the world I would have known this. And, and I look at you as a person who's kinda saved me, so I really appreciate it. Yeah.
Well, just remember that when I need something, okay?
Okay, sure. Always. Yes.
Well, there are so many others who are they're paying attention to this,
Yeah.
and what you've just done by sharing your story has given them hope. You're helping others by continuing to keep us informed with what you're doing. And obviously, I want the best for you. And we'll be able to identify that as we go through the process for those few steps that you've just got left to get you to a conclusion on it. So, from the bottom of my imperfect heart, my friend, thank you so much for doing this.
Well, thank you very much, Jeff, for having me on, and I hope to come back later and tell you that everything's been has been, resolved.
Let's hope sooner than later, right?
Right, exactly.
Mark,
Okay.
thank you so much.
Thanks, everyone. Bye.
Thank you for listening to Imperfect Heart. It's my hope that this information helped in some way to improve your situation or will help you better understand this condition. More importantly, that it gives you hope through stories that there is help and you most certainly are not alone. If you've been diagnosed with a myocardial bridge, please be sure to join the private Facebook group, Myocardial Bridge Support Group. For more information about our program or to reach me directly, visit the website, myimperfectheart.com. If you like what you heard today, please give a positive review, thumbs up, high five, whatever your app likes. And be sure to share with everyone important to you so they understand what it is you're dealing with. Please subscribe as well. Welcome each day with gratitude and positivity. The views and opinions expressed in this program are solely those of the host and the guest and are not intended to provide, nor are they a suitable substitute for, professional care by a doctor, therapist, mental health professional, or other qualified medical professional. Imperfect Heart is a production of Hear Me Now Studio.